Okay, so this is a continuation of the previous video, which was more explanation of the functional fetal, which is keeping a nice aligned spine, neutral spine, and this idea of like a deep squat to really pull into the core, disengage those hip flexors, which are often tight, and stretch out and open the low back, which is also often quite tight. So an easy practice that is probably familiar to most people with tightness in those areas and low back pain is this one single or double knee to chest stretch. So this is a nice kind of simulation of a deep squat without actually the stress or the strain or the load or those factors that balance that might be limited to get into that. So again, I'm bringing one or both knees up. It can be either or, but I have to pull my abdomen in, my stomach, and I need to tuck and anchor my ribs, not to pull my head or chest up. In fact, what I want to do here is straighten my spine and stretch to the crown and anchor my shoulder blades back if possible. At least once my knees come up, I can better do that. And then I want to try to channel that. Again, one or both. I could even straighten one leg. I can't right now because I don't have enough fabric in my pants to do that, but that's a good way to kind of work through that. You can rock in and out. You can even do, leg lifts. It's pretty hard to do both, but if you're able to do that. And one thing that I like to do is to lay on the ground after work or after a long day, or if I just need a quick reset, put my feet up on a couch. If you're laying on a couch, you can put your feet up on the armrest. Or if you're in bed, you might need a bolster, something like a bolster or something. You can do it like this in like a bridge position, but it just doesn't seem to be quite as effective. It also seems to kind of help relax things and lower blood pressure in that. So it'd be very helpful. But I will add also the arms. It's not really a functional fetal thing, but it does help to kind of open up and relax if you've got tightness in your chest. You can do a little movement here, just breathing. But it's very helpful to kind of reset things in the body. Okay, so back to functional fetal. We can take these pillows. You can, again, do this if you can get your legs up on something or, prop a pillow or two under your legs. But I prefer the sideline if possible, especially if you can lay on either or side. You can roll back and forth as needed, or you put a pillow between your knees, all that good stuff. But again, like here, I can kind of just gently, slowly kind of work my knees up, and I have to keep kind of pulling in the stomach, anchoring those ribs back, and trying to get those up. And then using gravity, just kind of keep everything in place and see if I can just kind of hold myself there. With my upper body, I'm going to put my hands together like prayer position. And imagine if I was sitting upright, I'm thinking like I'm lifting my chest and kind of diving upward. If I was upright, up and forward out of my seat. So that's my upper chest lifting while I anchor my lower chest ribs back and down and try to lift and then lower my arms and relax wherever I can. Here, maybe a pillow in front, or a small thin pillow on the side. But I want to try to even my head and my neck, kind of put it into a nice neutral, straight-ish posture, and then relax into that and see how that feels. I might initially feel some tightness. I'm going to just try to breathe through that and relax. Let that tension go and see if I can just settle in and just let it kind of hang out. But I want to, if I can self-palpate, feel my hip flexors, make sure right in the crease there as I come around from my front pocket towards the front, and then a little bit on the side, make sure that's nice and relaxed. My low back should be kind of open and relaxed there as well. And if that's too uncomfortable, I can try my other side, see if that's more comfortable. Maybe start there. So that's lying down. And then sitting, right? Think about trying to capture some of those elements. You're not going to be in that same position. However, what you can do is with a stool of whatever height works best for you. You want to think about comfort and how long can you sustain this, and how practical is it in the setup that you have if you're like in an office situation, or what you have available, maybe what you can start off with. So this one's a bit more of like maybe a 4-inch step. It's fairly low. This one is closer to like an 8-inch step, a bit higher. So you can do either or. I'm going to show the higher one just so you can see it better. But what I'm going to do is I'm going to put it, if I'm just doing a single leg, I might put it like this so I can bring the little foot up from the side. And again, maybe you can't see that as well. I'm going to angle this down if I can. a little bit there. So I'm gonna sit here at my workstation, we'll say, and if I'm specifically having trouble with that left, I might putting that left one up. I'll try that side first anyway, because that's the most likely to be beneficial, but there's a few key things you wanna remember here. I have to be able to align my hip and my leg. I have to be able to piston that back and shift my weight onto it. And so it's gonna feel like some effort to do that. So you gotta be mindful. Hopefully just having the stool there will help you to be aware and remember. But again, like this might be too high for some people to be able to maintain that posture. So that might be something you have to work up to. I can also reinforce this with a weight just for practice, not for work. But for an exercise, I can take the weight and I can practice that lift, like that upward dive kind of thing here. And I do not want any pinching or pain in my hip, by the way. Do not jam that up and make sure it's not tight. You want to get that inhibition of those muscles with that little bit of pelvic tilt. You want to be able to hold that, or maybe I'll hold my leg and kind of work here as I work into it. But I need to learn to roll that hip back and lift myself up and open up that hip. I do not want to pinch anything in there. I want to create space. Okay, but say I lose track of that and I'm always sliding back downhill this way. Okay, so that's where maybe you might have to switch it up just to trick your brain, so that now your weight's coming here and it kind of forces you. It's kind of like a leg lift without actually lifting up the pelvis. It just kind of kicks that one back a little more. But if you're already twisted that way, it may not be the most beneficial thing. So try the affected side first and then try the other one and see what you can do with that, and to make sure that that works for you. You can also try variants of that fetal position with an actual squat.